Rahim, Rabbi Shrahli, Sadri, Vayassirli, Amri, Wahlul Uqdatam min Lisani, Yafqahu Qawli. Respected teachers, dear student, Assalamu alaikum. Today I am going to discuss a very old drug that has been used in our life, and that is aspirin. So that was extracted from willow tree, and later on it is just like जैसे कि आप सब जो स्टूडेंट बैठे हैं पीछे एफएससी में मलेरिया की डिस्कवरी में सिनकोना बाग का था जिक्र. It is just similar to that. So aspirin, as you all know, is a non-steroidal anti-inflammatory drug, a precursor to aspirin found in the bark of willow tree, Genix salix, has been used for its health effect for at least 2400 years, containing salicylate. Hippocrates used salicylic tea to reduce fever around 400 BC. And these willow bark preparations were part of pharmacopoeia of Western medicine. In 1838, Perea isolated salicylic acid from willow bark. In 1853, chemist Charles treated the medicine sodium salicylate with acetyl chloride to produce acetyl salicylic acid for the first time. And then in 1893, Hoffman developed and purified salicylic acid for his father, who had rheumatoid arthritis. And 1899, then marketed aspirin by a pharmaceutical company. In Pakistan, this tree is quite common in Murree, Hazara, Swat, Azad Kashmir, Quetta, and Gilgit. And most of the senior people, हमारे बनफ्शा के नाम से बचपन में हमारे वालिदैन, whenever we got fever, used to treat us with that, and at that time it was very bitter और हमें बिल्कुल पसंद नहीं था. अब हम वही ग्रीन टी और इस तरह की चीज़ों में मिला के, but at that time no one was used to do this. This is the original pack that was first time in 1909 by a pharmaceutical company, and you can see the logo. It doesn't affect the heart, because at that time it was a safety concern whether it causes heart attack. So the company categorically announced that it doesn't affect the heart, and in 1948 Dr. Lawrence treated 400 patients, and he published his paper that it doesn't cause heart attack. Aspirin inhibits platelet. In 1967, Weiss and Elidott discovered aspirin that it inhibits platelet, and in 1971, British pharmacologist John Robert Wayne showed that aspirin suppressed the production of prostaglandin and thromboxane A2, and that is an inhibitory effect on platelet aggregation, and he was given Nobel Prize. So aspirin के ऊपर Nobel Prize भी मिल गया. In 1988, FDA approved aspirin for reducing risk of recurrent MI, preventing first MI, and preventing recurrent TIA. And there are multiple studies, as you can see, by FDA that shows the beneficial effect of aspirin. And this drug, apart from the indication that I have already told you, has been used in Kawasaki disease, pericarditis, rheumatic fever, and menstrual cramps, and long-term conditions like rheumatoid arthritis, osteoarthritis, and migraine. And people are using it in low doses for retinal damage, for diabetes, especially for those people who are having diabetes for more than 10 years, and in those who are hypertensive and with a risk of colorectal carcinoma. United States Preventive Services Task Force in 2016 recommendation that adult between the age of 50 to 59 may take aspirin daily to prevent colorectal cancer as well as cardiovascular disease. However, the guidance only applies to the adult in the range who are having at least a 10-year risk of cardiovascular disease. They don't have a risk of bleed like active peptic ulcer disease, having life expectancy of at least 10 years, and are willing to take low dose for at least 10 years. In stroke, aspirin 325 milligram daily should be given immediately unless the patient is receiving thrombolytic therapy, in which case aspirin is initiated after follow-up CT brain that has ruled out thrombolytic associated hemorrhage at 24-hour time. And then dual antiplatelet therapy should be used for next 21 days and followed by aspirin indefinitely. Acute stroke trial and international stroke trial recently demonstrated that starting daily aspirin as soon as practicable after the onset of suspected acute ischemic stroke moderately reduced the risk of recurrent stroke, reduction of 8% death in hospitalized patient, and improves the functional recovery. Then in acute coronary syndrome and stroke, aspirin, I should clear that in America it is given 325 milligram, in Pakistan and Europe it is given 300 milligram. 300 milligram immediately after heart attack, stroke, or another cardiovascular event to prevent further clot formation and cardiac tissue death. In those with prior ischemic stroke or acute MI, daily aspirin was associated with 19% relative risk reduction of serious cardiovascular, non-fatal MI, non-fatal stroke, or vascular death. However, there are minor 0.19% absolute risk of increased GI bleed. However, it is not recommended over the age of 70. Again, aspirin for primary prevention, you can see different studies, they support that this drug should be given. However, there is no benefit of same dose of aspirin in reducing the time of first cardiovascular outcome in patients with moderate risk over a period of 5 years. So this was a controversial study. Again, 22 guideline, year 22 guideline, people over the age of 40 to 59 who are having high risk for cardiovascular disease should decide with their clinician whether to start aspirin, small net benefit, with a 10% or greater 10-year cardiovascular disease risk. However, no benefit for patient over 70. So these are controversial controversies between United States and European guideline. You can see in the European guideline, again, American Heart Association between the age of 40 to 69, and you can see the United States Preventive Services Task Force, they are. So this drug should be given to all those people between the age of 40 to 69 who are having cardiovascular risk factor. Apart from this drug can be given to prevent cancer. But remember, to get this benefit, aspirin must be taken for at least 10 to 20 years to get the benefit. So this drug, similarly, aspirin can be used in pregnancy, in patients with preeclampsia and antiphospholipid syndrome. Aspirin safety among children, as it is related with Reye syndrome, so it should not be given to children unless it is extremely necessary, for example, in Kawasaki disease or patient having some cardiac surgery. So it should be given under supervision. There are studies that aspirin is also having benefits in different psychiatric disorders, but long-term studies are needed. But remember, aspirin should not be given to people having bleeding disorders like hemophilia, uncontrolled high blood pressure, asthma, bleeding peptic ulcers, advanced liver or kidney disease. In summary, you can use this drug in different conditions like patient having heart or blood vessel disease, evidence of poor blood flow to brain, having high cholesterol level, blood pressure, and diabetes, and those who are smokers. And with the end, these are two beautiful trees in Skardu Valley, Surchan and Merchant. Thank you very much.